It's 4:02, and we can start this grant route seminar for the CUNY Graduate School of Public Health and Health Policy. My name is Ilias Kavouras, and I'm the chair of Environmental, Occupational, and Geospatial Health Sciences. So a couple of procedural things. You are muted for this seminar. If you, during the seminar, you have any questions to the presenter, please post them on the chat, and then I will read your questions at the end of the presentation. Other than that, I think we are ready to start, and it's my great honor today to introduce a truly frontline leader and environmental health professional who played a key role in all recent public health emergencies, from Ebola to Zika, Cholera to Unaccompanied Minors, and the DoD, for us, the older generation, the DoD Anthrax Investigation back many years ago. And then, of course, more recently with COVID. So our speaker today is Commander Anna Khan, and we went through 3 rough years with COVID as a society and scientists. And Anna today will discuss some of these challenges from the CDC point of view, and being in the agency that really was charged to deal with this kind of emergency, so that next time we're better prepared and equipped to deal with this kind of emergencies, hopefully. So a little bit about Anna. She is the Associate Director of Communication in CDC's Division of Environmental Health Sciences and Practice, and she manages the Crisis and Emergency Risk Communication Strategy Development. She is the incoming president of the National Environmental Health Association, and leads the nation's response to emerging environmental and public health issues. Commander Khan also worked in global emergency management at CDC in the Division of Emergency Operations. We couldn't ask for a better leader during this time to plan the nation's and world's response to what is coming to us, working together not only at CDC, but with CDC partners, DoD, as well as the World Health Organization and Ministries of Health. I'm grateful that she agreed to join us today for the grant rounds and continue working with us in training the next generation of environmental and public health professionals. Anna, the floor is yours.
Thank you, sir. Thank you, Dr. Kavouras. What a wonderful welcome. Wow, it's a pleasure to be here with all of you today. Before I start my presentation, I just want to share a little bit of background in environmental health. I had the opportunity to talk to Dr. Kavouras about a month and a half ago about environmental health, and I just want to share with some of you that maybe your background isn't in environmental health. I've worked in environmental health a little over 20 years now at the health department, and from there at the federal level with both the Food and Drug Administration as well as CDC. So I just want to mention why environmental health services are important. Environmental health is part of disease control and prevention, and outbreaks only need 3 ingredients to occur. They need an agent, so something along the lines of a virus or a bacteria, and they need a host, so that can be a person or an animal, and they need an environment, so a surrounding that allows the agent to move to reach the host. The reason I'm mentioning this is because the surroundings can, the way it can affect a host is through air and water and food. And so what do you need when an outbreak occurs? Well, you need epidemiology, laboratory, and environmental health, and they have to work together. You have the epidemiologists who focus on the host, and they ask the who, when, and where. And then you have the laboratorians, and they ask the what. And then you have environmental health specialists who focus on the environment, and they ask the how and the why. And so we all work together to prevent diseases, but then we also want to ensure that outbreaks don't occur. So there's the prevention piece as well. So on with our scheduled program for today, after I gave a shout out to all those that work in environmental health, as well as our other colleagues in public health. Today, I want to talk to you about effectively communicating and promoting resilience to misinformation. So how do we help our friends and our loved ones and our communities find the truth? And the reason I'm going to talk to you about this today is because I think this is the leading issue in public health, especially right now when so many people are relying on social media and their phones to connect to the world. So let's just start with some questions, and feel free to use the chat for this. How many of you have social media accounts? Right. Yeah. But how many of you have seen public health misinformation in social media messages from friends and loved ones? I can certainly say that has happened to me from friends and loved ones. And if you haven't caught on yet, I'm from the South. So some of my people are up in the mountains, and it's a different world where I'm from. So you hear a lot of misinformation out there. So I just want to bring that up. So what I want to talk about is how communication has changed. People used to read the news through the newspaper or through television, or watch or just regular newspapers, or discussing things in groups after they received the news. But now information dissemination has changed. Now everyone is an author, an editor, and a disseminator. And we have rapid amplification and dissemination of information online. But more concerning than that is the long-term effects of misinformation and disinformation that cause mistrust and confusion. So, what can we do to overcome this growing problem? The first step is that we have to work together to effectively overcome misinformation. So, here is the bottom line up front. If you don't remember anything else from my presentation today, remember this: none of us have the ability to connect with all audiences. There are people in echo chambers that only listen to their so-called leaders or influencers. So in order to overcome misinformation, we have to work together. And within this presentation, there will be tools and techniques that you can use. So today I'm going to talk about and explain the significance of crisis and emergency risk communication, also known as CERC. We'll discuss the 6 principles of CERC and how to apply them. And I'm going to define misinformation, disinformation, and discuss cognitive schemas. And we're going to talk about rumors and misinformation and how they're plaguing our communities. And then I'm going to provide some tips on how to overcome misinformation. So let's start with crisis and emergency risk communication, also known as CERC. So it's an evidence-based framework and best practices for effectively communicating in a response for a public health emergency. And many of the communication principles of CERC also apply to high interest or controversial topics. CERC is a type of communication that is used different times in a crisis or an emergency, and it provides accurate and timely information to the public and to reduce the risk of harm. And the goal of CERC is to effectively communicate and provide guidance to the public in order to reduce the impact of the crisis or emergency event. and to manage the public's expectations and behaviors during the event. So CERC typically uses various different communication channels and strategies to reach the public. So uses social media, websites, news releases, and public announcements. But it also involves talking with community leaders and other stakeholders to help coordinate the response to a crisis and emergency event. And the content and delivery of CERC messages should be carefully planned and tailored to a specific audience. And it should also be considered what the challenge is. What is your communication challenge that you need to overcome? And it's important that CERC messages are clear, concise, and easy to understand. And they need to be accurate and timely. And it has to be about the situation, any potential risks, and actions that you want the public to take to protect themselves. So the reason that CERC is important is because communication science research supports the assertion that the right message at the right time from the right person can save lives. We're used to seeing and applying CERC principles during an emergency response, but there's also the need to adhere to it, these time-tested principles, even in peacetime, to overcome misinformation and disinformation. So some of the reasons that misinformation and disinformation are able to get a foothold in our audience's psyches is the same reason that people have difficulty finding and applying quality guidance during an emergency. So during this presentation, we're going to explore how we can effectively mitigate both scenarios by adhering to and applying CERC principles. So as most of us know, communication is very different during an emergency. In an emergency, there's often imminent or emergent threats, and people feel that they've lost control. And there's fear and there's worry. And this can be at the individual level, at the family level, the community, the national or global levels. So, how do we prevent this from occurring? Or at the very least, address gaps effectively and efficiently? So what we want to do is we want to start with, what do people want to know? We need to provide the information about the event, which includes what we know, what we don't know, and what we're doing to fill in those gaps. We also need to share information about how people can protect themselves, their families, and their pets. And we need to make sure that we share the most up-to-date information so that people can make well-informed decisions. And we need to make sure that we give people an active role in the response and in the recovery. This allows them to have control over their own actions. Giving people a role to play goes a long way in some sense of control and also predictability in their lives. And we need to make sure that we're sharing evidence-based public health recommendations that keep them informed on the latest guidance. And of course, it helps if they're given clarity on when we're going to start moving towards a return to normal or what a new normal will look like. And that way, it moves the audience towards the expectations. So let's discuss some of those guiding principles of risk communication. So the first one is, you want to be first. So you want to make sure that you get information out quickly, because crises are time sensitive, and communicating information quickly is crucial. In our information rich climate, there are many sources of information, and some can appear more credible than others. And there are also sources of misinformation that appeal more strongly to various audiences. So, due to how quickly misinformation can spread, especially nowadays, because of social media, it's important to speak first, communicate first, and engage first. And this helps avoid rumors and misinformation from being the first items that reach your audience and fill those information gaps. You also want to make sure that you're right. You want to make sure that you're thinking about credibility. So, accuracy establishes credibility. So, be right in your messages. The information can include what's known, what isn't known, and what's being done to fill in those gaps. Um, it's important to share information that you know is reliable, and it's one thing to acknowledge that there are things to be learned and more will be shared, but it's completely different if you share or claim information that turns out to be misleading. And then you also want to make sure that you're credible. So, honesty and truthfulness should never be compromised during a crisis. Like I shared before, it's better to admit that there's gaps in your knowledge and then share what you're doing to overcome that hurdle. Okay. And you also want to make sure that you express empathy. Um, Crises create harm, and suffering should be acknowledged in words. So it's important that you must be able to understand what the community struggles are in order to help them. And you must acknowledge their feelings. If you don't try to imagine what they must be feeling, what they're going through, and what they need, then your messages and your outreach will fail to be authentic. And empathy isn't the same as sympathy. Your efforts come from a place of compassion and understanding. So, acknowledging the feelings that your audience is going through, it adds a sense of humility. And then you want to promote action. Give people meaningful things to do to calm anxiety and help restore order and promote some sense of control. And then you want to show respect. So, respectful communication is particularly important when people feel vulnerable. Respectful communication promotes cooperation and rapport. It helps alleviate a class divide or an authority based relationship. Okay. And now that we've talked about how communication is different during emergencies, now I'm going to add some more factors that may affect your messages and how they're received and how they're perceived. So, in our world, it's likely that your audience will be diverse and there will be various features and demographics and qualities. And these differences should help you as you message and you perform your outreach efforts. So, for example, tailoring your communication efforts to align with or address factors such as language, needs, beliefs, and values. So, with all that being said, I'm going to share an example with you about the importance of understanding your audience. So, there was some free netting provided to some communities to protect families from mosquito borne diseases, but there were very few people that were actually using the netting. When public health officials asked people why they weren't using it, they explained that the color white signifies mourning. WHO then consulted the community leaders and discovered that green signifies life. And then green colored netting was quickly provided to the communities and they quickly used them. So making sure that you talk to community leaders and that you know what a community needs. On our end, on the federal government side, we should always go into a community knowing that the community knows what's best for them. We need to make sure that we talk with community leaders because they'll know how the best way to communicate back to their communities and the people who live in the communities. So there are many common mistakes that can occur when messaging. And I think here is the key to this message is to remember who your audience is, and that you're not messaging to yourself, which sometimes we get wrapped up in on the science side. So just got to remember who we're talking to and what their needs are. And now I'm going to transition into the overabundance of information, and we're going to talk about misinformation and disinformation. So in the beginning of 2020, WHO coined the word infodemic, which means the overabundance of information. And the catch here was there was just a huge amount of information out there, especially in 2020. And it was difficult to figure out what was credible and what wasn't. And what further complicated the spread of misinformation or misleading or fabricated news, images, and videos was this abundance of information that included misinformation and disinformation. And like a virus, bad information, whether it's misinformation or disinformation, it's highly contagious and can grow exponentially. So in 2020, WHO provided its first infodemic manager certification training to debunk public health misinformation. There were over 3,000 applicants, and there were 600 of us that were accepted across the globe for this training. It included public health communicators, it included journalists, public health professionals, clinicians, and epidemiologists. And we went through this training together and we worked on several projects. We shared struggles within our agencies and organizations. We shared examples of misinformation and disinformation that we were encountering. And then we worked on strategies on how to debunk misinformation and disinformation. So let's talk about misinformation and disinformation. Misinformation is false information that's being shared, but no harm is intended. So a good example of this is people come across information on social media and they share the information without looking closely at the sources, or because it's been shared with a family or a friend or a loved one, the information is seen as reliable. But then there's another example of misinformation that sometimes happens. Someone comes across misinformation on social media and they know it's not factual, but they decide to share it with friends and family and loved ones to talk about how ridiculous the content is. And even though most people within their circles may not believe it, there are others that see the message as a message of hope, and then they share it within their extended circles. Disinformation is knowingly sharing false information to cause harm. And this is usually done with a motivation in mind, such as political or financial gain. And then we have health misinformation, which is information that is false, inaccurate, misleading, or misleading according to the best evidence at the time. A good example of this is the remedies such as herbal tea or certain medications that were stated on social media as a way to prevent viruses. And we saw some of that over the last few years. And here are some types of misinformation. So we have misleading content, which is misleading use of information to frame an issue. We have imposter content, when genuine sources are impersonated. So we saw some of this on the federal side where people would take our logo and put it on content that was not true. Um, and then we have manipulated content. That what happens there is it's genuine information, but the imagery has been manipulated to deceive. So a good example of this is when you see a video that's been manipulated, such as a deep fake, for instance. Okay, so we're going to step over and talk about cognitive schemas. Um, so parsing information and judging the credibility of sources on social platforms will require our brains to adopt to a new cognitive strategy for processing information. So keep in mind that social networks are driven by sharing emotional content. So these sites are designed that every time a user posts content, it is liked, it is shared, and it's commented upon. And as social beings, we comment, like, and share the type of posts that best conform with the attitudes of our social circles. So today we're going to talk about two concepts. The first one we're going to talk about is information recall. So what that is it's misinformation that can affect information recall, especially when it's combined with other cognitive biases. The second concept is called backfire effects. And backfire effects can occur when misinformation is remembered as opposed to corrected information. And this is called backfire effect because the misinformation, when attempting to debunk it, is sometimes it backfires and it makes the misinformation easier to remember. There's also something called overkill backfire effect. And that happens when the information is easier to process, which makes it easier to accept. So a good example of this is there are 3 reasons why climate scientists are lying to you versus there's 21 reasons that you should believe in climate change. So if our explanations are too confusing or complicated, then the simpler, more straightforward sounding misinformation appears plausible. And so here's just a recap of the 4 ways that people process information. Now we're going to go into a scenario from CDC. This is what happened to us during 2020. And we're just going to dive into this example and how we overcame some of that misinformation and what we did. Okay, so in March and April of 2020, you may recall that cleaners and disinfectants were in the news. There was some misinformation about injecting and ingesting cleaners and disinfectants. Both Clorox and Lysol released messages to not ingest or inject their products. And the Surgeon General during this time, Admiral Jerome Adams, said through his Twitter feed, please always talk with your public health provider before administering treatment to yourself and loved ones. So now let's discuss on how we effectively communicated about cleaners and disinfectants. So CDC collaborates with the American Association for Poison Control Centers, which provide 24-hour professional advice and medical management information regarding exposures to poisons, chemicals, drugs, and medication. And CDC and the American Association for Poison Control Centers surveillance team compared the numbers of chemical exposures reported during January through March of 2020. And the data were from 55 poison control centers across the United States. During this time, there were 45,550 exposure calls related to cleaners and disinfectants. This was a 20% increase from the year before. And so we knew that we needed to get out information quickly. And so we developed a communication rollout plan for social media messaging. And we published a morbidity and mortality weekly report, also known as an MMWR at CDC. Our social media messages were posted in English and in Spanish, and they focused on chemicals contained in cleaners and disinfectants can be dangerous if used incorrectly. To take steps to poison-proof your home, and alcohol-based hand sanitizers can cause alcohol poisoning if swallowed. The social media metrics demonstrated that people were interested in the topic and thought that others should know about it. So, for example, our first message had over 300,000 impressions, over 6,500 engagements, and over 300 retweets and comments, and nearly 350 likes on Twitter alone. While on Facebook, generated 900,000 impressions and over 10,000 engagements. Whoops, there we go. But during this time, we also coordinated with EPA. We discussed how we could align our messages, how we could amplify each other's outreach, as well as how we could continue to move together to communicate and reach the public. And EPA augmented our messages. They had a press release on always following the product's directions and not to ingest or inject cleaners and disinfectants. The press release was provided in several languages, and then they released social media messages that we amplified. And this allowed our messages to be in sync, and it increased public awareness, and we were able to reach a more diverse audience. We also worked together to ensure that our information on each other's sites, websites, were easy to find. And then we took time to make sure that they complemented one another and that the information was up to date. So now let's talk about addressing the gaps. So at CDC, we're often involved in novel and rapidly evolving emergency responses. And as you can imagine, we're frequently messaging about uncertainty. And not only is it honest to acknowledge uncertainty, but it's also a source of the agency's credibility to admit that there are gaps that we're working hard to fill. So following the increase of calls to the poison centers, we looked at the gaps, and researchers conducted a nationally representative survey to identify the gaps in cleaning and disinfection. And there were some high-risk behaviors that we discovered, and one was the use of bleach on food products. And after learning about these gaps, we worked closely with EPA and FDA and other partners and we release messages through multiple channels. So now that we have discussed why messaging is important, let's talk about some of the other elements of communication. It's important to know who your primary audience is and who you're trying to reach. It can be the people that are directly affected. It can be responders, public health departments, community leaders, the media, professional organizations, NGOs, the business sector. Once you know who you're trying to reach, then you put together a plan on how to best reach them and through multiple channels. And then you want to identify your audience. So think about who's being impacted and who can help and who can change the scenario and who needs guidance and information to make a difference. And of course, when is the right time? You need to get the information out quickly, and the information has to be accurate. It's okay to not have all the answers. State what you know, what you don't know, and what you're doing to fill in the gaps. And is there just one audience? I think we're never dealing with one audience, with just one audience. I think that you have to consider this every single time that you message. And we need to consider the people that we're trying to reach with different communication platforms that are available. And then that's how you come together as a whole to protect public health. So a good example of this is I was working on a cholera outbreak in a community, and I was brought into a community meeting on how do we best reach the audience that we're trying to reach. And their goal was we need to make sure that people understand the importance of hand washing. And there was a representative from one of the schools, one of the elementary schools, and he said, let's teach the kids a hand washing song in English and in French. French because some of the areas spoke French, and English because other areas spoke English. And so they put together this really neat song, and they shared it with the kids at school. And before they knew it, the kids were singing the song also at home, and loved ones and friends and family were all picking up the song. And we heard back, and that was our best platform that we used in that community. And it became a joke that that was our viral message. It wasn't the flyers, it wasn't the social media messages, it was through the children. So, always remembering that there's other ways to reach your audiences and that there's more than one is a key element. Um, I've used other platforms as well. There was a community that received most of their information through WhatsApp. So that was a way that we communicated back to provide information. There during COVID, I saw some really unique ways to communicate about the importance of following guidance during COVID in other countries. And one of the ways was the use of an influencer, the use of a soccer team to talk about the importance of doing things in a certain community. So it's important to think outside the box and how to best reach the community that you're looking to reach. And it's important to incorporate best practices and also understand your limitations. So strong partnerships, collaboration, and coordination are key. With CDC, the agency has a role and responsibilities. And at CDC, uniformity of our messages and one voice is important. We have diligent staff who ensure through various levels of review that all of our messages are in line with public health data and that it has the weight of the entire agency behind it. But it's also important to recognize that through partners and stakeholders that help amplify our messages and bring about change, it could not happen without them. And as robust as the agency is, it relies on strong partnerships and collaborations and coordinations through partners, stakeholders at the state, local, territorial, tribal, and international levels, as well as professional organizations. And on that note, that is all I have. So Dr. Kouvaris, I'll hand it back over to you and we can take questions.
After 3 years, I should know how to unmute myself. So thank you very much. It really reminds us how we need to organize now or start putting these procedures in place now, because it's not a matter of if, but when the next emergency will come. And as you mentioned at the end, we need to build these partnerships now and start thinking about these activities, because during the event everything is chaotic. So with that being said, if you have any questions, please post it on Q&A. I have one from the Dean. Do you want me to read it or you want to?
Sure, go right ahead. Oh.
Yeah, I might as well ask it myself.
Okay.
You know, Anna, we were confronted with expediency in several situations, and expediency did trump accuracy. You were very wise in emphasizing in your presentation that we want to act quickly, but we want to act accurately. Unfortunately, it's not always possible, but I think you answered my question eventually by saying we should say what we don't know. And that's really wise advice to all of us. And I think we didn't maybe follow that advice accurately. So we jumped to conclusions sometimes when science had not really proven itself to be exact. And therefore the communication was either withdrawn or contradicted, which, as you wisely said, also generates obstacles with credibility.
You bring up a really good point, and I can tell you when I first started in communication, so leaving the field of environmental health and then stepping into comms, one of the first things I heard was we had gone through a hurricane and we were needing to message the community. And the first mistake we said was we knew that the water was no longer good, right? So we told the community to boil their water. Great advice, but if they have no electricity, they cannot boil that water.
That's so true.
Yeah. So,
but the other thing I was asking was the role, you're talking about partnerships. Could you tell us a little more about the role of the partners in the communication campaign? And then I will mute myself.
That's a great question. So I think this is the number one question I seem to always get, because it's so key to what we do in communication. And I think that sometimes that answer comes with some humility. No matter how hard I try, I know that not everyone is going to listen to CDC. And I know that there are others out there that they will listen to. So building partners before you have an emergency is really, really important. So some of our main partners may be bloggers. They may be people that are highly involved in scientific topics. And what we do is we have meetings with our partners and we talk about challenges or issues within public health and how do we get these messages out. And it goes not just at the federal level, but across the board. And there may be things that we're not thinking about. So for instance, we may think we know what the needs are of the community, but we may be completely off on the solutions because they also know their needs. And so having those partnerships, especially at the local level, is very important to ensuring public health.
Yeah. Please post your questions on the chat. don't raise your hands. Please post it on the chat. I have another question from Lauren Ports Ortega. How might you adapt these principles to counter health disinformation in non-emergency situations?
That's a great question. So that's really, really important. And I think that we sometimes see it, especially like, even though we consider climate change an emergency, it's been an emergency for some time, right? And I think sometimes when we address situations such as that, we want to overload people with information. There was something called the information deficit model back in the 1970s. And what it was is we provide all the information we can, and we know that people will make the right decision because we've given them all this information. But we have since learned that people's attention span, they do not want to read 20 articles that we've published that we've now handed over to them. They want that message at the very beginning, right? They want to know what they need to do. So back to what you're saying about non-emergency situations is we need to tailor our messages to those main points and think about the actions that we want people to take in order to achieve what we're looking for. So, but doing that, you also have to work within the communities to make sure that you're moving together as one. But you can do the same with non-emergencies, but you need to put together your communication plan. Who are going to be your main players? What do you want to happen, to achieve through communication? And if you have those main items, move with those pieces. Another thing to remember is, and this I think it always becomes a problem if you don't think about it, is that risk equals hazard plus outrage. So is a person upset about the hazard, what they're being impacted by? Or are they really angry because they've been impacted? So, and then determine how dangerous the situation is. So for instance, if you're in an area that have a lot of hurricanes, you may not want to leave every time a hurricane happens. So you need to make sure you message about the dangers and how dangerous that is. Whereas, let's say you have an oil spill and it's in a small area and the impact from the oil spill is not as devastating as you may think it is at first, but you're extremely outraged about it. How do you pull the outrage down and address the hazard itself? So you have to look at the risk from each one and determine how bad it is and how you need to message. So emotions are a very important piece of that you always need to think about.
Okay, thank you. We're getting the question. So there is a more information question here. Are these talking points about the infodemic training available at open.who.org? Can people find this information about the infodemic online?
Yes, so on infodemic training, they do have videos online through WHO about the different work that was done. And what makes it very interesting, and they do have a newsletter as well where they talk about different items that they're working on each month. And they're always looking for people interested in communication. So that's something else to keep in mind. This training is a combination between what we do at CDC as well as what I went through WHO.
And can someone do this training for the certificate now, or that was one-time shot?
No, actually, I think now they're doing it virtually. I think they've moved over to a virtual setting to where you can take the training online if you sign up for it.
Okay. And one more question is, to the extent that you can answer this, I know working for the federal government is an exercise. So how do excuse me? So it moved so fast. I miss. Okay, what would, in your opinion, the federal government do differently next time we have a pandemic, or how we can get prepared for this, the next pandemic?
That's a really great question. So, I've been through many exercises as we prepare for pandemics. I worked under Obama's global health security right before Ebola hit and through Ebola. And, you know, you always think your procedures are about where they need to be. And then you have something like COVID that hits, right? Um, and I think that there are a couple of things that we can certainly learn from. Um, and we are working on those through CDC. We have something called Moving Forward under our CDC director on how we're going to better collaborate between science, communication, and policy. And those are happening right now. And then we also are working on, because CDC is a very large organization, or I should say agency, we have over 15,000 people, and we all have our areas of expertise, but then it can sometimes become somewhat siloed. And you may have information on several different sites within CDC. So ensuring that all of our information is on the same page, that we're all communicating the same way, and that we work together across policy, science, and communication. So we are working on several things right now that will continue for the next couple of years to be more prepared for the future. Certainly.
Okay, and one more, the last, I presume. So, in general, we've seen it all. We see it every day. Actually, you know, it's much easier to spread misinformation than trying to correct or spread the correct information. How could we combat this kind of imbalance or asymmetry effectively in the future, or what can we do to
Yeah.
react to that or prevent it?
Right. So a few things. We all have websites, right? So as you put content on your website, think about what could possibly be a gap in your information. You also have to know that there are trolls out there, and there are people that like to spread misinformation, and and then of course we have bots that do that. So I mean, a long-winded answer. I mean, I would like to go on and on, but I know that it's going to take everyone. Everyone has to be involved with their social circles and to connect with them. And the key here is, and it's so hard sometimes and so frustrating, that you may have a friend or a family member that may not necessarily follow science guidance or recommendation, and no matter how hard you try, you can't reach them. And I know you almost want to take it to heart, and it almost can end up as a fight, or no longer having Thanksgiving together, for instance. But the best approach is to know that, you know, you may not be the best messenger. It may need to be someone else from somewhere else within their circle that may be able to reach them. And it's going to take all of us working together to communicate the best guidance, the best recommendations on what to do.
Okay. I think that's we are for today. I don't see any more questions. Last one. Is given that what we went through the last few years, is CDC working to develop any safe, kind of relates to your previous answer, safeguards against deep fakes or views or visual streaming media misinterpretations? Are we doing any prevention work?
So CDC does have a group that looks through messaging and looks for misinformation so that we can message on what we need to be talking about and moving forward on what we need to do. I expect through this plan, through our CDC director, under this new initiative called Moving Forward, that there will be additional things that we'll be doing to combat misinformation and disinformation.
Okay. Good. Okay, I think that concludes these grant route sessions. I would like to thank you again for joining us in these grant rounds. We are very pleased you are here today. I would like to thank all of you for attending this seminar, and we hope to see you next time. Thank you very much. Thank you, Anna.
Thank you.